Essential for cleaning staff in hospitals are overalls and waterproof footwear. Before starting work, it's advisable to use a skincare product on the hands. In addition, rubber gloves should always be worn to comply with safety regulations and provide protection against skin irritants. It's best to turn up the cuffs of the gloves to prevent disinfectant solution running down. The first important step is to get the right disinfectant concentration. This entails the right amount of water and the corresponding measure of concentrated disinfectant. The correct measures can be read off on the table. The easiest measure to use is a bucket with a scale marked inside. Then the contents of the disinfectant package are added. It's a good idea to leave the empty package in the receptacle, so it's easy later to tell just what agent is being used. To produce the correct solution for cleaning upper surfaces, the water is measured in the coloured buckets, which should be marked to make the job of measuring easier. And of course it's cold water that's used, since the disinfectants have been developed for a water temperature of around 20 degrees Celsius. Warm water unnecessarily intensifies the smell. Once again, the concentrates, which should be DGHM listed for hospital use, must be measured precisely, as here, for example, with a metering pump, which delivers 20 milliliter doses. Only the right concentration achieves the required disinfectant effect and avoids the unnecessary costs and smells of too high a dosage. The disinfectant should be chosen according to the area in which it's to be used. In the red and yellow buckets, for sanitary and toilet areas, an acidic preparation is chosen, which is measured out using a marked beaker. Acidic disinfectant cleaning agents are particularly suitable for wet areas because they disinfect and at the same time remove calcium deposits. Finally, colour-coordinated cloths are added to the buckets to ensure that the various areas are wiped only with the corresponding cloths. Disinfectant cleaning of patients' rooms should follow an established system. Cleaning begins on upper surfaces in the sanitary area using the appropriate cloth, which has been soaked in the solution and wrung out in the corresponding bucket. Once all surfaces in this area have been cleaned, the bucket and cloth are changed. Again, using the correct bucket and cloth, which are blue for patient areas, all the furniture and fittings in the patient's room are wiped down. The cloth must always be damp enough so that all the wiped surfaces are thoroughly moistened. It's not just a question of removing dust and dirt. The disinfectant agent must be allowed to develop its full effect on the surfaces. The optimum disinfectant effect can only be achieved if some moisture is left behind on all surfaces. Systematic work requires that the surroundings of each individual patient be treated separately, and that the cloth must be rinsed out and soaked with the solution again each time. The final stage in cleaning the patient's room is washing the floor. A fresh mop head is put on and soaked with the disinfectant solution. And once again, there's a systematic method for cleaning the floor. Begin at one side of the room and clean all surfaces, including under the bed, working towards the window. The mop is always used in such a way that the dirt is picked up in one direction, ending up at the door, so that the dirt can be swept out into the corridor. The mop head is removed and disposed of in the receptacle for used mops. Very dirty mops should be shaken out into the rubbish sack first. The modern two-mop method uses a dry mop head to go over the wet floor surface, leaving behind a film of moisture. The disinfectant cleaning of surfaces is particularly important in shared toilets and washrooms, because certain germs which collect here can reproduce very quickly in these damp surroundings. All fittings here, therefore, such as handles, tiles and wash basins, must be thoroughly wiped down with disinfectant solution. The basin is wiped down on the outside first, and then on the inside, working towards the plug hole. Here again, the cloth is rinsed out in the solution repeatedly. Acidic disinfectant cleaning agents not only achieve the desired disinfection, but also remove calcium and urinary deposits. Once the bath, fittings and tiles have been wiped down with the yellow cloth, the toilet area is then cleaned and disinfected with the red cloth. The cleaning work is finished off by washing down the floor with the appropriate fresh mop heads. For disinfecting and cleaning corridor floors, the modern mopping technique we've already seen is again used. A fresh mop head is laid in the drainer, attached to the jointed mop, and soaked in the disinfectant solution. Excess liquid is squeezed off in the drainer. The surface is then mopped down using a figure-of-8 movement. It's important not to stretch too far with each movement so that an upright position can be maintained to avoid back strain. For the other half of the corridor too, the mop is moved backwards along the wall, and the figure-of-8 movements are then repeated so that the whole surface is wetted right to the edges. The first mop head is replaced and the floor is mopped again, as with the two-mop method, using a dry mop head. This leaves a film of moisture on the surface. As soon as it's dry, the floor can be walked on again immediately. For smaller areas, which have to be disinfected quickly in between times, for example with a change of patients, ready-to-use alcohol-based disinfectants are the agents usually preferred. Objects and upper surfaces, including the walls, are thoroughly wiped down with disinfectant. The lamps, for instance, the infusion stands, tables, stools, in short, all equipment and fittings are wiped down and thereby wetted with disinfectant. At the end of the working day, members of the cleaning staff must thoroughly clean their trolleys, leaving all the equipment ready for use the next day. It's a lesson that Dotty Doublequick has learned and taken to heart.